importance of holistic approach. I still remember my first consultation with you when I had come, how you did not just put me on medication, but you sat me down and gave me you told me about my sleep, my diet, my routine. So what the importance of holistic approach, and we'll start off with a few commonly asked questions, in that being one of the specific ones is, are there any specific supplements or dietary changes that can help reduce inflammation in lupus? This is also a very controversial question, is what
Yeah,
I have
agree with
seen.
you. Very difficult to get scientific evidence for this type of support system, but only these are the things are in our hands. So we can't change our genetic susceptibility. We can't change our gender. We could not go and undo the infections you have had in the past, antibiotics you have in the past. So what is there in front of us is only lifestyle and few supplements which we can use. So as I might have told you, we have only sleep with us, diet with us, exercise, and mental relaxation, and we can to a certain extent be aware of the pollutions around us, cosmetics, plastics, which can promote autoimmunity. So beyond that, we can't do anything. So we can do only what we can do. So one of the commonest and everybody should use is vitamin D, because we are also asking people not to go out in sun and use sunscreen. And vitamin D, low vitamin D is also associated with pro-autoimmune disease profile. So taking a little bit of vitamin D, like a 2000 units equivalent per day, and taking a multivitamin just to cover anything missing in your diet, it makes a common sense. We don't know whether it will really make a big difference to the disease, but there is evidence on vitamin D helping the lupus patients. And anti-inflammatory diet, like what is anti-inflammatory diet? Avoid processed food, avoid junk food, sweets, less salt, and more fiber. That's all. In simple words, eating more fiber, less processed food, and more natural food. So more fiber, the food has much better gut health. Much better gut health means much more protective immune system, or not an angry immune system, but a calm immune system. Something called T regulatory cells become more. Generally, they quieten the immune system, and so that can help.
Okay, doctor, thank you so much for that question. One more thing is, how do stress and emotional health impact the lupus activity, and how can we manage that better?
Yeah, stress is again, see, during stress can be many. It can be physical stress, mental stress. So, and good stress, bad stress. Called distress, eustress. So, getting a job is still a stressful, it's called eustress. So, every stress has some positive and a negative connotations. So, stress also causes a lot of epigenetic changes, like a lack of sleep, stress can make multiple gene to express in a different way, because it changes the way gene responds to the environment. So having a stress-free life definitely helps in dealing with any disease, particularly autoimmune disease. How do we deal with the stress? That's what's important. And the easiest way is to have friends and increase the social activities and planned social activities. You can have a pleasure activity scheduling. Okay, every Saturday evening I'm going to go for a walk or a park or have a restaurant, whatever it is, with the friends. That can help. Having a hobby definitely helps, because many times if your mind is busy with a hobby, or if you are happy with doing things which you like, many times immune system also becomes a little more quiet. And sometimes you need a help of a mental health professional like clinical psychologist. If the stress is too overbearing, that the stress is occurring from you have a lupus and you are just going through a breakup and you are losing a job. This, if it adds up, it can be very stressful for people. Sometimes they require the help of a clinical psychologist.
Definitely, doctor. Thank you so much for that the answer. Coming to the next question that is again commonly asked, most patients, as you told, are young women or young in the younger age group where their career is being shaped or they need to make choices as to what next. I mean, I myself was had to rethink my career options after being diagnosed. So, what are a few recommendations that you would give for patients who have to make a career choice with respect to keeping lupus in mind?
Again, this is a difficult question and difficult choice for both the caregiver and the patient, because if you have the strong will, no, there is no barrier. So people can. I have my own patients who have lupus who have become police officers. People have become doctors. There are few people who have joined the army as nurses. So it is possible. There's no real barrier, but um, the jobs which require constant sun exposure, lot of traveling, outdoor activities could be avoided. And if you have a lot of brain fog issues, intellectually very demanding job may be difficult for you. So these are the few things I can think about. But otherwise, the disease is very well controlled. There is no job which is out of bounds.
That was very inspiring to hear. I'm sure many patients are happy to hear this and are looking forward to, exploring their passion and choosing a career. So this brings us to an end of the importance of the holistic approach, where you have spoken about the things that we have in our control to keep the disease under control. That is the sleep, eat, food, diet, routine, exercise, how to manage our emotional stress, and also giving us a brief about how anything can be achieved if done in the right way.